Hello, this is Dr. Evans. Today's topic is what should you do if you get a nosebleed? So there's all sorts of crazy advice out there for what people should do when they have a nosebleed. Some of it is completely useless. Some of it's actually counterproductive and may make the nosebleed longer. So you'll get it straight from the horse's mouth today from an ear, nose, and throat doctor. Here's what you should do if your nose bleeds. So I'll tell you right off the bat, 90% or more of all nosebleeds start right in the very front of the nose. So if you look at me from the side, it's kind of right in here. And it's normally coming from the wall down the middle of the inside of the nose called the septum. So that area on the very front of the nasal septum is an area where a lot of different blood vessels kind of converge to the same spot. So it tends to be a common area for bleeding. So as a result of us knowing that, we can find ways to stop that bleeding more easily. So the best way to stop any kind of bleeding is to put pressure on the bleeding spot. So the best thing you can do if your nose bleeds, get your 2 fingers, pinch your nose, and just hold pressure there. By doing that, you're likely to get pressure right on the bleeding spot inside of the nose. If you're doing that for, 10, 20, 30 seconds, and it still seems to be bleeding some, just adjust your fingers a little bit. Try and maneuver them around a little bit until you can hopefully get pressure right on the bleeding spot. Fortunately, most nosebleeds are not harmful, and most of the time they stop within a few minutes, even if you don't do anything else. But by putting pressure, by pinching your nose, you can usually stop a nosebleed much quicker. So if you're someone who's getting lots of nosebleeds, they're happening all the time, they're not stopping easily with this sort of simple tip, come and see me. We can look for the source of the bleeding, and we can usually get it to stop on a more permanent basis for you. Anyway, have a nice day.